coming to this session. My name is Lori Geffel. I am a risk communication specialist at the headquarters of NECCOM, and I am a former 1035. I started my government career in 1980. Well, I started in 1983, but in 1985 I became a public affairs officer. And what happened for me is I took my first risk communications training class from AEHA, or CHIPM. Have any of you been around since AEHA or CHIPM have been around, right? Which is now the Army Public Health Center. But I took my first risk communication training class in like 1989 when I was kind of a green PAO. But for me, it really shifted how I thought about communicating. That communicating isn't necessarily just a one-way thing through a press release, and it's not waiting for the media to ask me something. Communication should be cyclical. We should be reaching out and understanding our audiences and listening to them so that we can then develop better messages and products. So it really sparked my interest in this idea of risk communication. So I was very lucky. I started out at the Test and Evaluation Command as a PAO. Then I went to what is now the Army Environmental Command, which at the time was the U.S. Army Toxic and Hazardous Materials Agency, USATHEMA, for those of you that have been around a really long time. And then I was a PAO for the Program Manager for Chemical Demilitarization. So for all of my time as a PAO, everything I did was bad news. It was either environmental contamination at somebody's house, or it was perceived smokestacks influencing them because of the chemical agent that they were burning. And so I found that risk communication became one of my go-tos as a PAO. And then I got really fortunate in 1997. So for 20 years, I've worked for the Army's Medical Command, and I was the senior risk communication consultant at the Army Public Health Center until 2011, when I had the opportunity to come up to the headquarters level, because I believe very strongly that these risk communication skills belong at the headquarters level, not only in the public affairs world, but in our leaders as well, and that they do belong at DoD. And I hopefully over the course of time that will happen. And so what one of my first slides was going to be was, this is what I learned over the course of working on nothing but bad news over the last 30-some years, and I wish I'd known when I was a young and up-and-coming PAO. And so instead of showing you the slide, I just want to tell you a couple things that I thought I learned. One of them was that I think that as a young PAO, I should have been better at being able to recognize when risk communication skills and tools would have helped me. And those are some of the things that we're going to talk about today with our panelists, and some tools that will help us be better at that. Because risk communication is different in the sense of it's more collaborative, and it sort of tries to understand the perceptions that are involved and what are the barriers and challenges to our communication effectiveness so that we can factor them into our communication planning to be better. Because this session deals with how do you communicate when there is a bad news situation, when there are emotions involved, when people perceive that something is going to affect them adversely. How do we communicate more effectively about that? And so I felt that I could have done better as a young PAO if I had recognized when risk communication tools could have been helpful to me. And one of the second things is that as a PAO, to the extent that we can, recognizing that a lot of our shops are one person deep, we need to focus on building relationships so that when the stuff hits the fan, we have trust already with those audiences that we need to communicate with, so that when we have to tell them that we can't do anything else for you, or we're not going to do a health study, we're not going to reinstate your vacation time because you thought the building was making you sick, it makes those conversations more satisfactory, not only for them, but for us. So dedicating time to build those relationships. And number 3 was plan and take actions to address the emotions and the fears that are involved in these kind of situations. Instead of assuming that a press release or a media interview is going to equate to effective communication, we have to have plans and strategies and actions that we can institute to address the fears and emotions that are involved. Because in those situations, there's very clear evidence, and my panelists are going to talk about that, there's very clear evidence that until people believe that until you acknowledge what those concerns and fears are, they're not physiologically able to hear what you have to say and the message that you need to deliver. And so I want to turn it over to my 2 expert panelists. I'm really thrilled to have Dr. Catherine Rowan from George Mason University. I've been following her research for quite a long time, and in the trainings that I do, I very often reference her cause model that she's going to talk about today. She is the director of George Mason University's graduate certificate program in science communication. So she teaches crisis communication, public relations, risk communication, and public relations science, risk and crisis communication, and has done presentations for a lot of federal organizations and has an extensive research background. And our second panelist that I'm very pleased to have is Dr. Mitch Moravitz, who teaches at the University of Maryland, University College, where he is a collegiate professor and chair of the public relations program in the graduate school there. And we have the double advantage with Mitch's experience because he comes from the world of Army Public Affairs, where he was an Army Public Affairs person for 30 years. So I feel very honored and very privileged to have both of them come and join us today. So Mitch is going to lead us off. Again, I've got slides, and I apologize for that. You will get the slides after the fact if they don't happen to work today. You will get them after the fact from the message that Papa sends out. Thank you so much.
Thanks. So I'm not getting paid for this, so I don't want you to think that I'm pushing this book, but I do want to introduce you to a wonderful book that's actually not a bad read for a working professional called Crisis Communications, a Casebook Approach. It's by Dr. Kathleen Fern Banks, F-E-A-R-N Banks. And she's a professor at the University of Washington. And she breaks down the role of communications in a crisis very succinctly, very easily readable, with wonderful examples. And I highly recommend this when you have nothing else to do. It's a great read. It's actually a very good read.
Mitch, how's our volume? Can everybody hear us? Yeah, Mitch, if you could speak up, I think it might be hard to hear in the back.
Oh, okay. Gosh, you know, this is like the first time in my life I've ever been asked to speak up. So I apologize. I'll try to speak in a more eloquently, more as if I was in theater. So anyway, the first thing I want to do is talk to you a little bit about the crisis life cycle. We tend to think of crises activities as being either pre-crisis, during a crisis, or after a crisis. Three big buckets. Well, a couple of theorists who suggest that there's a little deeper thought that needs to go into crisis planning. First of all, I want to mention that you can plan for crises. Don't think for 1 minute you have to wait for a crisis to occur before you think about what you're going to do. It's almost always too late if you wait for the crisis to hit you and then you react to it. So, think about crises. Spend some time talking to your colleagues and your peers, to your bosses, about crises. And I'm going to show you a couple of ways to think about them and to prioritize your planning activities. So, but the first thing is the crisis life cycle. We talked about pre-crisis and then post. Pre-crisis, crisis, post-crisis. There's the author, Dr. Fern Banks. She breaks it down a little bit more finely. She talks about detection. That is to say, being able to see things happening, activities happening in the real world that are telling you there's something wrong and something bad is going to happen down the road. She calls them predromes, but it's in this idea of being able to detect what's going on, scanning the landscape, knowing what's happening. Then she talks about preparation and how preparation can actually help prevent crises. The very act of thinking about them, talking about them, the possibilities of a crisis, and then coordinating with staff, the operational staff, about what might happen if something were to happen, can sometimes prevent a crisis from occurring. So planning can equal prevention in some cases. Once a crisis occurs, Fern Banks suggests we need to contain it. A crisis is often defined as an activity that inhibits the normal activity of an organization. So something that happens and stops you from doing what you normally do can be defined as a crisis. And the idea is to contain that activity, to prevent it from spreading to other elements of the organization or to other organizations, and consequently get your organization back to life as normal as quickly as possible. And then she talks about what we would call evaluation. She calls it learning. And that is the summative evaluation of what occurred. The murder board. What did we do right? What did we do wrong? What can we learn about it? What can we change in our next iteration of the plan? There's another guy called William Crandall, and he only has 4 divisions in his Breakout. He talks about preconditions, not too dissimilar from Fern Banks's detection and prevention, right? He also talks about a trigger event. In some respects, that predrome that Fern Banks is talking about, but he's talking about something that actually starts the crisis. Being able to recognize that. And then he talks about crisis activities and post-crisis activities. Okay. So if you understand this framework of a crisis life cycle, then we can talk about how you identify and prioritize potential crises. I like Fern Banks's ideas of a inventory. So she has a crisis inventory, and she actually in her book, on page 301 of her book, she actually will tell you these are the kinds of crises that you might be thinking about in your organization. And she'll tell you right off the bat that she's not in the Army, and she doesn't know every crisis that Army public affairs officers might encounter. But the idea is to get you thinking. These are the kinds of crises. What other kinds of crises are missing from her list that you might encounter in yours? Then she says you take each one of those crises that you've identified, and you have to do 2 things. You have to determine, 1, how likely is it to actually happen? And 2, how destructive to the organization can it be if it does happen? And she prefers to use a visual bar graph. So you create a bar for each crisis, and each crisis has 2 bars. One is likelihood, and the other is potential damage. And you can see really quickly, visually, what are the most important crises and what are the most likely to happen crises, and then you have to analyze those 2 elements, and then you can prioritize. What are the first ones? What are the first ones that I need to tackle? And that is your prioritization for crisis planning. Questions about that? Okay, great. Let me turn it over to Kathy, because she's going to give you a framework to conduct planning. We're not going to teach you how to do a communications plan, because I think you all know how to do that, and you all know the different elements of a communications plan. We're here to help you strategize about that very planning process, okay? So, higher level skills.
Thank
Kathy?
you. Thank you. Applause for Colonel Marovitz,
Oh.
doing it without the slides. Thank you so much. So in this portion, what we do is apply what Colonel Marovitz just said. So we all can kind of intuitively say, my goodness, it is good to plan for crises. Let's do it. We have 8 situations that Lori Geckel and I identified that are ongoing right now in the Army. You all are public affairs officers. Pull out a pen. If you can, grab the handout. Page, here it is. We're on number 1. So our first challenge is, which one do you want to tackle? And so I'll go through the first 8. They are live situations. I want you to think about which one you want to analyze. Thank you for this context. And then I'll ask you to turn to some people next to you and think about which one do you want to plan with each other. So let's see, where are we? Does this move for me? Excuse me.
Okay. So it doesn't work? Try it now.
Thanks.
You have to point it here.
Oh, where do I point it?
Is it on?
Oh, do I just need to turn it on? That could help. Thank you.
Try it again.
That helps, yeah. Does it work?
I think you're facing.
Oh, thanks. Yay! All right, we got it. Okay, situation 1, sexual assault. Woman officer was assaulted. The assailant was tried, found guilty this summer. The problem is the victim is on social media on a site called Army WTF, telling people that we didn't solve the problem, going after that one assailant. Many people failed her. She's naming names. She's putting it out there on the site. Write that down, sexual assault, social media. What's your plan? Obviously, we're not going to solve the situation, but we're going to talk about challenges. Situation number 2, West Point. The game is coming up, Army-Navy, December 9. You hear word, this is hypothetical, that some of the football players from West Point are going to take a knee during the national anthem. Write down West Point, take a knee. What do you do? Everybody got a pen? Anybody? We're all writing. So you're going to ask, we're going to get you involved here in just a moment. All right. Media. The next one is transgender. We all know that's in the news. Very important issue. Your office and General Allen says that issue is important. I've got other issues that are important, like how about readiness? I've got 3 of my 58 brigade combat teams that have enough equipment and training to do their job. Could I get some media coverage on that? That's a dangerous, bad situation. Next situation, warrior transition units. As you know well, those are situations where very severely wounded officers are in particular units. There's coverage in the media about them getting inadequate care. One young man was over-medicated and died in his 30s, and large article in the New York Times saying that somebody declared that he died of natural causes, but the man was in his 30s. What's going on with our wounded troops in those units? The next one, Military Times 2017 says TRICARE is expanding mental health care. That's the good news one. How might we share that information, that there's more coverage for mental health? How might we share that in a respectful way that doesn't imply everybody who comes back from a certain deployment is required to have that treatment? Here's another, Philadelphia Inquirer. This one, anybody working on this issue now? We have PFCs, perfluorinated compounds, are contaminating the drinking water at over 400 installations throughout the nation. You're doing that one? Okay, here we go. All right, so this one sounds familiar for anybody who did other compounds that have contaminated drinking water. So write down PFCs, contaminating drinking water. Do you want to work on that one? Next one, medical error. So all kinds of medical error. We have Army hospitals. We have people. We're going to have error. You have situations like instruments that are not sterilized. That gets coverage in the news. What do? Let's say your office says, gosh, it sure would be nice if we got some coverage about those 57 healthy babies that get born every day in the Army hospital. Or how about all that excellent drilling we do? How come we're getting so much coverage on these medical errors? And last and not at all least, write this one down. How might public affairs earn the confidence of commanding officers so you can work effectively on these issues? Or how might you further earn the confidence of lay stakeholders? So let me pause and let you have 2 solid minutes to look around and find somebody who looks friendly and that you're comfortable talking to. Talk about what issue do you want to think about as I go through the cause tool for thinking about strategic communication. So take a moment, I'll stop talking. All right. Oops, here we go. So, why are these situations hard to talk about? Part of the reason is that you don't want to make it worse, right? It's already a challenging situation. You don't want to make it worse. Part of the problem is there's privacy issues on these things that we need to navigate. Part of the problem is you don't want to come across as defensive in these situations. Another challenge is, what is your protocol for social media? When do you get on social media? Do you want to get on a site that says Army WTF? Do you not want to get on a site? What's your protocol for that? So dive in back to number 2 there. What we need is some tools for thinking about these situations. So first, what the heck is risk communication? Dr. Marovitz talked about what crisis communication is. Risk communication is ongoing danger, so uncertain, ongoing danger of any sort. Some people say it equals news. It equals a lot of the news. But essentially, risk is any kind of danger, either physical or reputational. Crisis is the moment when it's actually occurring, and those are differing communication challenges. A key insight, and an insight that helps us to be strategic, is that we think about danger differently, whether or not we're the manager of the danger, so if I'm in charge of that Army hospital, or whether I'm the people who are affected by it. And that's our sort of strategic avenue into this situation. If we're the managers, we have a tendency to feel defensive. If you go back in military history, back in the Roman era, some of the leaders were saying that, the troops are, rotting and doing terrible things. Oh, that's just a couple bad apples. So even back then, we still had those problems. And our problem is, though, that defensiveness, that this isn't us, this isn't me, goes to the core of who you are. You do believe you're Army, you're the managers, you're trying to protect us. You are protecting us. You're protecting those troops. So it really hurts. It really makes you angry when there's coverage that says you're not doing a good job. On the other hand, if you think about it from the stakeholder point of view, they're often thinking of it as, that's my child in the military, or I'm the soldier and I'm dependent on you doing your job, and if you're not doing your job, I need to know that, and I need to know what I can do to protect myself. So from the stakeholder perspective, we need to think about what are the questions they're asking themselves. So you're in the middle between the two, between the managers and the stakeholders, and so the mission is, how do you think about how to address the questions that both groups very rightfully have? All right, so I'm going to use this cause idea. It's just the letters cause, C-A-U-S-E, 5 letters to help us think about intellectually what might be some of the likely questions people have in their minds when they're thinking about some danger. So let's go through, and that's, let's see, number 3 on the slides here. Here we go. So first of all, what the heck is cause? The way to use it is just to go down the left column here, and notice how I have positive words here. The way to use it is turn them into negative ones. Why don't I have confidence if I'm the spokesperson at my base about mental health options for TRICARE? Why might people not trust me as I say, hey, there's more benefits to get? Why might people be suspicious of either my motivations or my competence? Why might people be suspicious about what I have to say about whether or not we're covering the infection control procedures in the hospital? So earning confidence is incredibly important. We have a tendency to think the whole problem is here. I'm just creating awareness and understanding, and frequently we need to earn the trust or the respect of the people we're working with before we can get here. So the difference between the A and the E is A is detection, just knowing what the danger is. We don't all know what PFCs are. We don't all know about, if there was an accident out on 395, we wouldn't know. We're in this building. So that A is just a detection. The U is understanding. Often I need some deep understanding to understand the issue. We're having more and more floods in this era. There are a variety of reasons. One of them is sea level rise around Alexandria and the Federal Triangle. We've had floods for years. They're getting worse. We need to understand what are all the reasons why we're having more flooding and how does that affect the military. The S stands for satisfaction with solutions. Even though I know about the flooding, or I know about the healthcare, or whatever it is, I may not agree with the policies and the approaches for addressing those situations. And the E is enactment. Just because I think we ought to devote more time to wounded troops doesn't mean that I'm actually doing anything about it. When's the last time I wrote to my congressperson to get more money for the military or the wounded troops? What is my behavior? How am I acting to bring about that change? So let's go into each of those, and what I want you to do is just jot a note or two to yourself for the situation you're analyzing with your colleagues. What are questions you ask? So the first one is the C, and that is, why might people not trust the spokespeople? Why might they not trust their character or their competence? So think about the hospital sterilization problem or the wounded troops. Why might you not be trusted on that issue? Is it your competence? Is it your character? And then think about why. One reason, there's lots of reasons, but one reason is it's frequently opaque to people. They don't have a way of monitoring how the military is doing its business, your management processes, and that gives you your strategic insight right there. If they can't see the monitoring of it, what you do to keep the hospital clean or what you do to help the wounded troops, one thing you can do is show them your process. Maybe you do that with tours, maybe you just describe the process, but at minimum you can show them the process and show them who they contact and show them where you are in the process. Another thing you can do is just remember, if you go on the internet and type in Peter Sandman, this is his famous line, it's track us, don't trust us. Don't assume people trust us. Do assume we need to be trackable to the extent possible. In some classified environments, you can't be trackable, but many managerial processes can be tracked. All right, let's move on then. So you've got for the C, do you have monitorability? Everybody's got that one down. How do I make myself more monitorable? There's other things you can do to earn confidence. You can do things like create listening opportunities. Maybe with the sexual assault, are there ways you could create more listening possibilities? Are there best practices we could find out from other people? But let's go to the A now. How do you create awareness of danger or warnings if they don't have them? In some ways, the question is more straightforward here. It's like, what channels do I put my messages on, and why are those the right channels? Additionally, and a little more subtle, is people aren't aware of things that they don't have a vivid, compelling, evidence-based story about. So some slow onset problems like readiness, you know, if we're having fewer and fewer troops that have enough training and equipment, we need compelling evidence-based stories to know that, to know what's happening. So a very good book about how to tell a good story that's evidence-based and powerful and gets people's attention. Do you all know this book? How many people have already seen this book? Made to Stick? Yes, in the back you have. So that book says essentially go out and find evidence-based stories that you can share with spokespeople within your service and also to media to make sure you get some coverage of readiness if that's what you want coverage of. Just one story that I found was that after Hurricane Floyd in North Carolina in 1999, 1,400 people a week were coming in for mental health counseling after the floods. The number tells you right away those people didn't have biological conditions right away that related to mental health. They had a traumatic situation they went through, which suggests in 2017 we need to up our capacity for mental health counseling. Okay, another aspect of the A is what do you say in the crisis? So Dr. Marovitz was talking about crisis situations. A good tool we could train our spokesman people on is the 3 W's or the 5 W's. I'll do the 3 W's here. But that's just what you think it is. We've all had journalism, right? We know what the 5 W's are for a news story. So the 3 W's in a crisis are say what happened. So if there was an accident out on 395, you say that. Then you say what you're doing to fix the problem. You know, bad accident, we're blocking traffic to the Seminary Road 395 exit. And then what can you do to address it if, you know, what can you empower the people to do? You know, there's another way to get out of here. You know, go down Seminary, take a left, and go up to Lincolnia Road so you can get back on the Beltway the other way. But anyway, you try to tell people what they can do to protect themselves. So one thing we could do is practice and drill spokesperson training in the crisis. How do you give the 5 W's when you're the spokesperson? And people usually pretty much respond to that. I think if I stood you up right now, you do a really good job of saying, here's what we know, here's what you can, here's what we're doing to protect, here's what you can do to protect yourself. All right, let's move on to the U in cause. This is for those situations that are a little more complicated, so you can tell people about the traffic accident, but often there's a lot of things that people don't understand. And sometimes what we know from research is, obviously the long polysyllabic words are hard for people, but what's really interesting is very simple words are confusing sometimes. So the ideal strategic plan pre-tests some of those messages. For example, in Washington, D.C., we learned the hard way in 2003 when we had Hurricane Isabel. People didn't know the difference between evacuate and shelter in place. They didn't grow up next to an oil field. They didn't know. about shelter in place. And so they thought shelter in place meant go drive to a public shelter somewhere. Anybody from this area remember this? But yeah, so that's not what they want them to do. They wanted them to stay in your house, stay where you got food, and don't get out there on the Beltway, please. So at any rate, pre-testing your messages helps you think about what words may not be understood. Another step is to think about, is there anything we could do to help people visualize the complexities of the situation? Why do we need wetlands to increase our capacity to reduce flooding? Why is that a good thing? Or why do we need more golf courses or parks or something along the coast and not lots of buildings that are just going to cost money when it floods? So when you have a key term, what the research says, I think intuitively we all know, what do you do to explain the term? You just say the definition and the example. The research says it's a little more complicated. People will get it more fully if you say what it doesn't mean. So shelter in place is not the same as evacuate. What it does mean, shelter in place means find a place you can be where you can get food, water, medicine, whatever, and just walk through some examples. That might be your car, it might be your office, wherever you are at the moment. Analogies and pictures, I don't need to go through that, we get that, but maybe we need a picture of how the wounded troops are processed, like where are we in the process or maybe we need a diagram of the infection control procedures in the hospital. If we had a breakdown there, maybe that would be a possibility. Let's go, I'm going to skip that one so we have lots of time for discussion. Let's go to the S in cause. So that's a different situation. We can all get it. We know the engineering or the science of the situations that we got the contaminated water or whatever. Then we get to the tough part. Okay, so how do we figure out what to do about it? It's easy to agree, yes, we need to spend money for the wounded troops or the contaminated water. Where the rubber meets the road is how much money? Is it going to be a lot? Is it going to be a little? Is it going to be moderate? So one thing we want to think about as we have policies and as you support policy, decision-making, policy, money, support for the military is have the less expensive plan, the middle plan, and the most expensive plan, and encourage discussion about what kind of money do we need in order to have ready troops or have the right medical care for our wounded officers. Let's skip a few and go on to, I think we got that. All right, let's go to the E in cause, which is getting us to actually act. So what I'm going to do is not talk about our situations that you're analyzing right now, but talk about us. Right now, we can all agree, yes, it would be good to be strategic public affairs officers, but will we be? When you go back to the office on Monday, are you going to start strategic planning? I think it's a lot to ask a single individual to change a whole office. But one thing you might think about is there a group of people that are oriented toward being more strategic at your installation who'd be interested in having more strategic planning? And if so, what would you do? Some steps you might take is people tend to do things if they're social and routine. So could you have, strategic Monday every morning? So every week we do strategic planning. We do, where's Dr. Marovitz? We do that exercise, of, all right, what are the 10 things that could happen at Fort Bragg or in wherever you are? Which ones do we think are the worst? And which ones do we want to have a strategic long-term plan for? And then maybe make it social. Could you have a friendly competition with the Air Force or the Navy or the Marines? Who's doing the best job of strategic planning? Could you look for best practices among other groups that do strategic planning? I'm very impressed right now with FEMA has a new, if you go to their website and type in Preparathon, you'll see they have a strategic plan for communities around the nation to do, they put the kit out there of how to do the plan, and then they encourage the community to come up with your own plan about, some communities it would be wildfires, some communities it would be floods or whatever, but I bet they would love to partner with you about how do we do strategic planning. So make it so that you access those things. Then you might do report cards for yourself. You could do internal, kind of where are we on strategic planning here? We give ourselves, a C for this and a B for that or whatever, or maybe report cards for that a hospital. How's it doing on each of its things? And perhaps share the report card with the media, which would be a way of controlling some of that news that's covering the challenging issue. Obviously, Professor Marovitz and I would love to have you join us at our graduate programs in strategic communication. There are many around the nation. Mitch, you did Syracuse's Graduate program, so I think communication is a popular subject, and you can find it, throughout the nation. But perhaps C, we frankly learn a lot when you join our classes. We have some Air Force officers in our classes at Mason, and they teach us an enormous amount. So it's very much a win-win when you join us. So to summarize, we naturally are very defensive when there's bad news about our organization. We may be angry.
No, I'm not.
Yeah, exactly. That's exactly how we feel. So the idea here is to use what Dr. Maravitz said and to use this cause thing as an intellectual tool to, instead of being angry, ask myself, well, why aren't they feeling confident in me? What can I do to earn their confidence? And it puts us in a better place strategically. All right, so we now have time. How much time do we have? Aha, we have a whole, 10 minutes? 10 minutes. Okay, so back to your group. Think through cause, and I can put that back up on the slides. We can put back up any slides. So work up your initial questions or your plan and be ready to report out to the larger group in 10 minutes. Report out to the larger group. What situation did you have? What are your thoughts about it? What questions did you ask her? Yes, sir. Go ahead. All right.
Put that off in my part.
Yeah. Here he is.
Well, so we try to use your model for the transgender issue on allowing transgenders into the military to participate in hiring. And to gain the confidence of our commander.
Chris, it's hard to hear you.
Oh, really loud. Thank you.
So we're talking transgender versus the readiness. So we need a larger hiring pool. Our leadership has decided that we're going to allow transgender in the military, and that is an important factor. But what we're going to advise the commander is there are many factors to readiness. Allowing transgender individuals in their army is just one of those many factors. And what we really need to focus on is the outcome and not the symptom. The outcome is readiness is an issue. It's an issue with facilities. It's an issue with training. It's an issue with the need for a more predictable budget. And yes, there is a need for more manpower, and transgender is one of those things. So what the engagement is, the understanding and the satisfaction of this with the commander is, sir, stay on the strategic message of readiness and what are the key factors that affect readiness. So if the reporter is here to talk about readiness, transgender is a factor. The risk is if you stay only on that one message, then the risk is high that this emotionally charged issue may go one way or another, and the commander won't have the confidence that it's going to go well. But he will understand the fact that that's just one piece in a larger puzzle, and he needs to lead the reporter to a greater awareness and thereby the general public.
Good, applause for our first group. Nice job. All right, so anybody follow up? Anybody else on that issue? Any other group do that issue?
Let me just ask a question.
Yeah.
We purposely went that way to try to lead a discussion for that if we were way off base. But you have a specific issue transgender, but it's the old bridge to the bigger picture. In a risk communication world, is that a technique that you're trying to advocate, or are you supposed to be focused solely on the risk aspect?
Let me give an answer, but Professor / Colonel Maravitz has more years than I, so I'll be interested in his. But what I'm wondering is, could you have a vivid story for each one? Tell me a vivid story about the transgender and how that's helping with readiness. Not naming the name of the person, but this capacity that.
But if that was your purpose, but if your purpose is to bridge away from the emotional issue to get to the.
I'm wondering. So this is a good discussion. So I'm wondering about the bridging thing. It is possible. One possibility though would be to have a very compelling readiness issue. I mean, I have to say, when the Air Force officer taught me about the planes falling out of the sky, he, in that instant, got me thinking, I think I need to be more worried about those planes falling. But maybe, but it was an evidence-based story about readiness.
And I don't disagree with the example, but the example would be more leading them to the readiness issue of the large picture.
There's nothing wrong with bridging like that, but the only thing you have to make sure is that in the process of bridging away from the issue that you're being asked to talk about, that you don't lose the confidence in this, that they don't feel as if you're taking advantage of them, or that you're avoiding the issue. So there's an art to that bridge, okay? And you have to do it in such a way that you don't lose the confidence.
Yeah, yes, sir.
I think another thing you need to do, because what caught my eye was, or caught my ear was, in that particular issue, you can bridge away into somebody else's talking point. So if you bridge away into readiness, and they say, well, transgender troops have got to go through medical this, and they got to go through medical that, and they cost this much money. And so are they really a readiness, enhancer when in fact they're going through medical things all this time, and they cause and now you've bridged into somebody else's talking point because, they're on the other side of the issue. So you have to really know the other, the counter before you bridge into something.
Great. Another group, thank you. Another group. Anybody want to report out?
Okay. We did the TFCs in the water source because I just lived that at Joint Base Lewis Report. And
So sorry.
but interestingly, it wasn't a problem, and then it became a problem because PFCs are chemicals that result from one element is firefighting foam that was used back in the 60s and 70s by the Air Force to fight fires on airfields. It also comes from Teflon and pouch fabrics and other stuff in the 60s and 70s in landfills. Anyway, JBLM had the problem because we inherited the Air Force Base as part of our joint base. Okay. But then the EPA, 2 years ago, the standard was 400 parts per trillion in your water source. And then the EPA changed the standard to 70 parts per trillion. So one moment our water sources were good. The next moment we weren't. And the EPA told everybody across the nation, test your water sources, military and civilian communities. DOD moved out smartly, the Air Force and the Navy first, and then the Army coming behind them. But we were a little bit behind. And but once you tested your water, you now had 30 days to report to your public what the results were. The results at JBLM were we had to take 3 of our 15 wells offline because 3 of them were contaminated, barely over the 70 parts per trillion, but they were. Initially, we had our scientists put together an information paper. It was 3 pages, and it was so technical, nobody could have understood it. So our PAOs dove into it, dumbed it down to about a 6th grade level. The primary message was water on JBLM is safe because the contaminated wells have been removed, and we're going to continue doing monthly monitoring and eventually install filter systems to get them back online. But once we had the info paper done and we released that, and it was so simple, we put it out on social media, full news release, sent it out to all 5,000 homes on base, and we had 1 response afterwards because it was so easy to understand. So we kind of built the confidence in us, understanding and awareness all at the same time.
I like that. And maybe I'm interested in monitorability. How might we monitor the monitoring of the wells?
One of our biggest challenges, though, was as we were preparing to do that, Naval Station Island, north of Seattle, they have a much greater problem than we do because on their base, it seeped off base into the civilian communities. And they're actually paying to give people off base bottled water, which is a huge cost.
Wow.
And the Seattle Times was working on a story about them, wanted to include us in the story. I'm trying to tell the reporter, our problem really isn't that bad compared to the Navy. But I didn't have to go approval to tell them that.
That's it. Thank you so much. That's a really good story. Let me just get a few more report outs. They're telling us we've got to watch our time. Any other groups want to report out? Any other situations? Joe, want to report? Go ahead.
So we did ours on the officer that was sexually assaulted. And we kind of got into a little debate over here. It was healthy. We'll just all up a little bit. But we were just kind of talking about, do there, with everything that's coming out in the media nowadays, everything that's coming out in the media nowadays about people coming forward about being sexually assaulted and things like that, it's a hot topic right now. So we were just kind of going back and forth a little bit about being careful not to victim blame. And I caught myself getting defensive, saying, well, you know, we don't know that it's true or not. You know, so is it proper to, I guess our biggest question was, is it proper to say, just acknowledge the problem and say that, hey, we have, you know, we have a zero tolerance policy for this. We have processes put in place to do this investigation and get to the bottom of it the best way we can. But is that insensitive to say something like that? Should we say something along the lines of, you know, this is a bad situation when it happens to anybody, and we understand there's pain involved, and we're going to do everything we can using our processes and our SOPs to get to the bottom of something like this. So.
Thank you for laying out those messages. Let me just, anybody want to comment on those two?
I do, actually.
Yeah.
That Facebook Live thing on, okay, I'm going to be a little bit flawed about that. A lot of times our approach is, if something goes like that, the first approach is what? Under investigation done, we're not talking about it, and then we batten down the hatches and wait. And we had a situation at Fort Benning. I don't go into a lot of details, because a lot of details aren't done. But if we had the slide back up, we go over the
Sorry.
no, I'm kidding. Yeah. But the thing is that you know, I was one of the last to find out, unfortunately, because the commands, our command at Benning and Trade Off Media and Aqua sort of got together and said, hey, we're going to go active. And of course, I just about dropped the gold duck. But I said, okay, here we go. What are we doing? And so I drafted up a couple things. We got together, and through about 3 echelons, and very well synced, we came up with quite a lengthy statement that basically said, yep, we've had this allegation. This person brought it forward, confidence in the system, an indirect message, confidence, bringing it forward. This is what happened. This, we didn't go into a lot of details about what was said or what we did, but we said we were made aware of this, and we started this investigation, and what else we're doing. And they said, and I said, okay, who's putting this out? And they said, yeah, Ben, you are. And I'm like, whoa. So about 8:30, we did our calisthenics and stretches, and then we put that thing out there in email. And after about 200 plus emails, telephone calls, even Facebook messages and stuff like that, the very next day, because that's what we wanted. That was all. They wanted to know more details. I mean, I had all the old pals from the Pentagon, David Martin, and the rest of them called. How many are there? What's their names? How many victims? How many have been accused? How many are involved? How long has this been going on? And all that stuff. All that's under investigation. And here we are protecting that. But we put out very well coordinated all the way up through the chain of command through echelon. And it was much better than the initial things like, don't say anything. So I would encourage coming back and looking at trying to do that next time. And you shoot me a note, and we can talk about this and work on that as best we can. But it worked. It shut it down. I mean, it was absolutely more effective than sitting there saying, no, it's not going to do it. So,
Let me jump in here, and I apologize, because I know that our session is ended, and I don't want anyone to stay here that it doesn't want to continue to have the discussion, so please feel free to get up and leave if you want to. We certainly are willing to stay and continue discussions, but I just didn't want to make you think that you felt obligated to stay. Even though I think it's a great discussion.
So this is really good. So did you want to speak? Yeah, and then.
Just to add on to that, so then after it's under investigation, the big thing is once something comes out of that investigation, you have to follow up, keep the confidence and your credibility. So you just put out that, okay, we did this investigation, and we don't say anything. So if charges are filed or whatever comes out of the investigation, you have to follow up and put out a message on top of it too.
And there was a hand over there, right?
Yeah, I think one of the points that we haven't addressed is that where was the information coming from? And it was coming from WTF. So that is a different news source, and I think that we kind of looked at the cause and looked at the confidence, how you earn that confidence. So WTF is different. That's a great approach, but the confidence, how you earned it, one, with WTF to make sure you can either shape what they're putting out and not let it just completely go down a snowball, which they will. and have you shaped that with your commander to say, hey, what do you think about WTF or other social media platforms like that, BuzzFeed, those types of things? You know, are you good with me engaging? When can I engage? This is what I'm thinking about. And that confidence on both ends, kind of reaching out, because yes, for traditional media, that's absolutely correct. We had the talk, well, yeah, as soon as it's on WTF, Army Times, other places, and if you can reach out to the Army Times, a wire service first, or almost simultaneously, sometimes that helps a lot, just like you did, and that way that WTF, it kind of goes away. Jose's not at your installation recording, but I think that's really one of the pieces to that. I mean, if someone's feeding something to them, they'll just keep releasing and releasing and releasing until you do something like just, hey, mass blast, a wire service as fast as possible, and Army Times, and try to get in front of it a little bit. But
Did you
Yeah,
want
I just was going to add, just wanted to, this is a great discussion, by the way, and what I would urge you to do when you go back to your units and you're sitting there thinking about the kinds of things that can go wrong and which are the ones that are really meaningful to your organizations, that could really hurtful to your organizations, and you go through this strategic process that we've been discussing this afternoon, and then you put together your plans, which you all know how to do. Practice your plans. I know it's very hard to convince a commander who's very busy, who has a very busy staff with more mission than he's got resources, to carve out a couple of hours every couple of months or an afternoon every quarter or 6 months. But this is your challenge. If you want to be professional when a crisis occurs in your organization and you want to come off earning that confidence from everybody, it has to be practiced. And it has to be practiced to the point that when a crisis actually occurs for you and your spokespeople and your team, it's just another day at the office. So it's a challenge. I know it's a challenge, and I you know, I don't envy you your jobs.
And I'll say the last word here because I know we're running over time. Number one, you got the Red Book, which is CDC's Crisis Emergency Risk Communication Guide, which is CDC is the leader in federal government regarding risk and crisis communication. I also created my own risk and crisis communication handbook for the military. It is medical oriented. And on the slides that you will get in the long run, the link to this is there. I also have a risk communication scale, a risk prediction tool, several other things in there. I've been trying to build frameworks to help public affairs people be better at communicating when emotions are involved. So that's number one. Number two, I thank my two panelists so much for taking their volunteering their time. They